Hello. Thank you all for joining today in our remembrance of International Overdose Awareness Day. I would like to let everyone know that this will be recorded and that we will have a Q&A after the speakers have finished. My name's Tamara Olt, and I'm the Executive Director of Broken No More and Grasp, and we're a group of people who have come together that have lost people from substance use disorder and to help each other in our grief and also to help educate and advocate for sane drug policies. We try and make a change from criminalization to advocating for a health-based approach to substance use disorder. I'm an obstetrician gynecologist in private practice, and I lost my son Josh at the age of 16 in 2012 to a heroin overdose. We didn't know he was using drugs. It was a complete shock to our family. We were absolutely blindsided and devastated. And pretty much right away, I tried to figure out what had happened, why, how could this have happened to my son, to our family? And that's when I became educating myself on specifically opiate use disorder, trying to understand why people use, and most importantly, what we could have done to prevent Josh's death. So I've spent the last 14 years trying to save others, other families from the complete and utter devastation that we've been through. And on Overdose Awareness Day, it's a day to remember and honor our loved ones and to raise awareness about the opioid crisis. But it's also a call to action. 70,000 people died in 2025 from overdose. That's 70,000 people. That's 70,000 families and even more friends, acquaintances. Almost everyone knows someone affected by substance use disorder. There's a lot that we're trying to do. We've accomplished a lot since Josh died. The first ambulance that got to my house in 2012 did not carry naloxone. There was no naloxone in my community. There was no harm reduction agencies, nothing. So a lot of that has changed, including access to naloxone. We've done a good job getting that out to people, and especially to people who are most likely to use it, which is people who are using together or family members of people who are using. What we haven't done so well is prevention. I remember wanting to go talk in the schools when Josh died about what I didn't know anything about this, or was anybody talking to my kids about this? And all we had was DARE, and we still don't have any good science-based, reality-based education programs for our teens about how to save themselves, how to save each other, what to do if you have a friend who's using, what to do if you have a substance use problem. And I really don't see that that's gotten any better in the last 14 years. The other thing that we've had in place is harm reduction practices and naloxone, and we're doing pretty well with that, but we could do better. But with the new administration, we are pulling away from harm reduction practices. We are closing syringe access programs. We are telling people just to suck it up, stop using. And for recovery, we need treatment on demand. We need access to life-saving medications like methadone and buprenorphine. And what we're currently seeing is a push to the abstinence-based model, which is deadly, especially for people with opiate use disorder. They're 90% failure rate with abstinence-based treatment. And it does have its place. I'm not totally negating it, but these medications reduce mortality by 50 to 70%. So we cannot push these out of the way. We're seeing recommendations to limit the use of buprenorphine And that's not okay. People can be on it as long as they want. I'm a buprenorphine provider. I don't have that discussion with people about weaning, let's get you off. No, if you have to be on it the rest of your life, then you have to be on it. I'm diabetic. I'm going to need my medications probably for the rest of my life. I'm not weaning off of them. I will die if I do that. And so will people who need medications for opiate use disorder. Another thing that's continued on is we've been advocating for years to end the war on drugs, which is really a war on people who use drugs. And we're just currently, we're ramping up. We're ramping up the laws. We're giving harsher penalties, longer prison sentences, especially if a specific drug is involved, like fentanyl. And these will not help. We know that. We have the data from 50 years of the war on drugs that criminalization does not decrease overdose. It does not stop people from using. So we have to back off of that. And like I said, we want to advocate for health-based solutions, science, evidence. We have evidence to support everything that I've mentioned that we need to do. We know this works. So let's stop putting people in prisons. Stop. When we ramp up these laws, people won't call for help. And I know many people through this work whose children have died alone. They've been dropped off in a parking lot. They've been dropped off in front of a hospital, which that's better than the parking lot, or left in a basement to die. But these kids, these people were afraid of what would happen to them if they were involved in an overdose death. And that fear is real. And we are currently creating more of that. So I will stop for now, and we'll move on to our first speaker, which is Kimberly Douglas. And her daughter, India, is also here, and she'll speak after her. They are a mother and daughter who lost their son, brother, Bryce, to overdose, and have since organized the group Black Moms Against Overdose and Bryce's Treehouse, and they are from Maryland.
Thank you, Tammy, and thank you for having us as part of this panel today. So I'm really grateful. Good afternoon, everybody. As Tammy mentioned, my name is Kimberly Douglas, and I'm the mother of Bryce Jackson and the founding director of Bryce's Treehouse. I'm here first and foremost as a mother. I lost my son Bryce to an accidental overdose in June of 2023. But before I tell you how Bryce died, I want you all to know how Bryce lived. He was my son. He was loved. We have a loving family. He had big dreams, a great personality, a future, and people who loved him deeply. And his life should never be reduced to the way that he died. This is why International Overdose Awareness Day is so important to me. It gives families like mine an opportunity to say the names of the people we love, to honor their lives, and to remind the world that behind every overdose statistic is a human being. Behind every number is someone's child, someone's mother or father, someone's brother, sister, partner, or friend. And behind every one of those lives is a family that will never, ever be the same. Bryce had mental health issues that were intensified by COVID. After COVID, he began experimenting with marijuana and graduated to pills to feel quote unquote normal. Bryce died here at home from a fake Percocet. After losing Bryce, my grief eventually became a call to action. As Tammy mentioned, I founded Bryce's Treehouse in his memory because I knew that simply telling Bryce's story was not enough. I wanted his life to create change. As part of that change, we must figure out how to respond to people who use drugs. We cannot arrest our way out of this overdose crisis, and we can't incarcerate our way out of addiction. And we cannot continue responding to pain by creating more pain. For decades, the war on drugs has shown us what's happened when we choose punishment over public health. Black communities, communities of color, and poor communities have disproportionately carried the consequences of criminalization and incarceration. We should not repeat those mistakes. And at a time when we are finally seeing overdose deaths decline, we should be investing even more in the strategies that are helping people stay alive. not taking those resources away. That means making naloxone readily available. It means expanding access to medications such as methadone or buprenorphine. It means drug checking tools, overdose prevention services, and treatment that meets people where they are. And most importantly, it means recognizing that a person has to be alive in order to recover. I often think about what I would have wanted for Bryce. I would have wanted someone to help him. I would have wanted someone to see his humanity. I would have wanted someone to give him another opportunity to come home. What I would not have wanted for Bryce or anyone struggling like him was to be sent to prison in the name of saving his life. That would not have saved Bryce. Families like mine know the devastation of overdose. We know what it's like to receive that call that changes everything. We know what it's like to wish for one more conversation, one more hug, and one more chance. So when we tell policymakers that we want harm reduction, treatment, compassion, and support instead of criminalization, they should listen to us. We're not asking people to ignore the overdose crisis. We are asking our leaders to respond to it with policies that actually save lives. Bryce is the reason I will continue to speak out. I will continue to say his name, and through Bryce's treehouse, I will continue advocating for a world where people who use drugs are treated with dignity, compassion, where families have access to resources they need, and where we stop believing that punishment is the answer to pain. On this International Overdose Awareness Day, I honor my son, Bryce Jackson, and every life we have lost. And in his name, I'm asking elected officials, choose compassion over criminalization. Choose support over punishment. Choose policies that keep people alive, because every life is worth saving. Thank you again.
Thank you. India, would you like to go ahead?
Hello, everyone. Good afternoon. My name is India Jackson, and I am the older sister of Bryce. I also serve on the board of Bryce's Treehouse Foundation. So my mom has shared a lot about Bryce and our foundation and why this work is so important to family. So I'm going to speak from a little bit of a different perspective, not just as an advocate, but as his older sister. So losing a sibling kind of changes you in ways that are really hard to explain. Bryce was someone that I thought would be a part of every stage of my life. There's so many milestones that I've gotten the chance to experience since losing him where I've thought, man, Bryce should be here for this. And I think that's one of the parts where overdose loss that people don't always see. The loss doesn't end the day that you lose someone. You feel their absence at your birthdays, graduations, holidays, any family gatherings you may have, and even some of those random everyday moments where you just wish you could call them. For me, being involved with Bryce's Treehouse has given me a way to really carry my brother's legacy forward. I'm a young woman who never imagined that overdose awareness would become such a big part of my own life, but I learned that doing this work, that my voice does matter, especially because there's so many young people who think overdose death could never touch their family or circle until it actually happens. I want people that are my age to understand that this crisis is closer to us than sometimes we may realize. I want us to have honest conversations about what substance use is without shame or judgment attached to it. And I want people to know that resources do exist before their family is one day desperately searching for the answers to all their problems. I can't change what happened to Bryce, and that's something that I've had to learn to live with, but I can decide what I do with the love that I do still have for him. And I can say his name, I can tell his story, I can educate other people, I can advocate, and I can help make sure another family has the information or the support that we wish that we so desperately had at that time. So today, as I honor Bryce, not simply because of how we lost him, but because of how much he got the chance to live and how deeply he was loved and how much of his life continues to mean to me and everybody else he impacted, everything in this space will always start there. Thank you.
Thank you, India. Our next speaker is James Moore. He lost his son Jeffrey to an overdose. And since his loss, James has been a tireless advocate, fighting to save other parents from losing their child to a preventable overdose. And James is from Mississippi.
Thank you. We lost our son Jeffrey at the age of 24 following a decade-long struggle with addiction that began in junior high. In hindsight, I never realized that the drugs were not the problem, but rather a response to the underlying issues. As a dad, I wish that I had focused more on working on those issues rather than focusing on the response and the drug use. A parent's response to a child misbehaving is punishment in hopes of correcting bad behavior. Just like in our society, our response to citizens misbehaving is punishment, arrest, and then incarceration in many cases. But my response of punishment only added trauma to the already underlying trauma in my son. Just like many of our laws dealing with those caught with drugs only inflicts more trauma on those already traumatized. I was a police reserve officer in our small town when Jeffrey was a young child. I remember the first time I confiscated a small amount of marijuana on a traffic stop from a teenager. I went home that night thinking that I had literally saved our city. In hindsight now, I know that I just cost a kid a few bucks, and I increased the profits of his dealer, who quickly resupplied him. I know now that cutting the supply of a highly desired commodity only increases the demand, and that someone will always step in and fill that demand. Jeffrey checked himself into a local treatment center and was doing well until he was kicked out for violating their tobacco-free policy. In addition to opioids, he was also addicted to nicotine. He overdosed and died 8 days later. According to his therapist, other than the use of a legal product to which he was addicted, Jeffrey was a model client, never failed a drug test in the 60 days that he was a patient in the facility. Naloxone may have saved him if someone had told me about it when I picked him up. I learned about naloxone in the weeks after his death watching an episode of Nurse Jackie on Netflix. A drug rehabilitation center is the only medical facility you can check yourself in for treatment and then be kicked out for manifesting symptoms of what you checked yourself in to be treated for. When Jeffrey was in treatment, I cleaned his house. I cleaned it thoroughly of all the drugs, all the paraphernalia. And when I returned to the home the day after I discovered him overdosed there, I found 2 syringes. Apparently, someone used with him, and when things went wrong, they fled the scene rather than calling for help and staying behind. That's why I am opposed to drug-induced homicide laws. Those laws only ensure that more sons and daughters will die alone, when they could have been saved by given a second chance at life. My son worked at the family business, our bicycle shop, when he was going to school. One day following a period of sobriety, it was clear that he had relapsed again. The disappointment in himself was evident, and I was feeling that he may leave and not come back. I called him into this office that I'm speaking to you from, and I closed the door. And I said, "Son, I can't put myself in your shoes. I don't know what your life is like, but I'm beginning to understand now that by the time you wake up on time, clean yourself, dress yourself, feed yourself, and clock in here at 9 o'clock with the rest of us, that you have probably put more struggle in your day at that point than the rest of us will all day in ours." And I'll never forget that response. It was, "Thanks, Dad." I'm so thankful that I had that one moment where I could get it right. As a dad, my biggest regret is that I did not reach that level of understanding of his addiction sooner, when sooner might have yielded a better result. Recovery is not about a bad person becoming good, but a sick person becoming well. And we need to shift our thinking so that our drug policies increase the chances of healing rather than adding more trauma to the already traumatized. As a nation, we need to increase, not decrease, funding for life-saving measures like syringe services, access to naloxone, access to treatment, access to medications that are proven to help family members and others struggling in our communities get the life that we want for all Americans. And in the words of former Surgeon General Vivek Murthy, how we respond to this epidemic is a moral test for us as Americans. Are we a nation willing to step up and simply care for one another? I hope that proves to be the case. Thank you.
Thank you so much, James. You made some really good points. I really appreciate your speaking about the treatment industry, because it's caused us to lose a lot of our people instead of helping them. And I would like to remind everyone that you can post your questions in the Q&A box as we go, so that we can respond to them once we're finished. Let's see. Our next speaker is Kelly Sirianni. She's a certified psychiatric rehabilitation professional. She lost her brother Joey to an overdose, and she is an advocate for health-based solutions to the overdose crisis. And Kelly is from Pennsylvania.
Hi, thank you so much for having me today. My name is Kelly Sirianni. I lost my brother, who was my best friend, during the second wave of the overdose epidemic in 2010. So we're going on 16 years, but it still feels like yesterday. He struggled with addiction when he was about 14 years old. I was about almost 18 at the time, so he was my younger brother. His struggle lasted for 13 years when he overdosed at 27. His drug of choice was heroin, but at the end it was a polysubstance overdose. My mom found him and tried to do CPR on him to no avail, and this was before Narcan was available. When he passed in 2010, this was his fourth overdose in a week and a half. So when I think about my life right now, it's in two parts. It's, before he died and after he died. And it's after he died, I got married and had kids. So I feel like I'm living two lives right now. But he is always a part of my life, and I will continue to speak for him. And that's why I really greatly appreciate the opportunity for you to allow me to tell a little bit of his story. I make sure to tell my kids who are 9 and 11 about their Uncle Joey. He was 6'4", and he was a lover, not a fighter. He was the nicest kid that you knew. He was in the gifted classes in school. He was in the DARE program. He was very empathetic. He was an old soul who couldn't hurt a fly. He had underlying mental health issues, which inevitably led to his drug abuse. He was funny, loved the Philadelphia Eagles, the Phillies. He was very politically engaged, wanted to become involved in, he wanted to go to school for poli-sci. Before Josh Shapiro was our governor and our state rep in the little town of Abington, he would when he would come by to visit, he would get him there for an hour to talk about politics, things that needed to be changed with mental health. And he was a huge advocate for other people because he knew what it was like to be in the system, and he wanted to make a change. His friends still tell me all these years later that he would take his shirt off of his back for you. All the girls that he was surrounded with said that he was one guy that they felt comfortable being around because they knew that they could trust him. But when he was 14, his in our area was it was a very diverse area. We had a very wealthy portion of our area, and that's where one of the parents introduced my brother and his friends to opiates and benzos. And 4 of those children died before the age of 27 that would come to this house and use. After that, in the the overdose epidemic in 2010, the drug rules and laws got much stricter with the prescription medication. So that's when all the kids started to doctor shop and found certain doctors in the area that would prescribe them medications or just give them benzos and opiates if they wanted to. At that point, I got really involved, going to doctors' offices, calling people, reporting them. And when some of these places finally got shut down, the kids discovered, well, that we're going to use heroin and go down to Kensington. So at that point in time, we struggled. I would get very angry, of course, as his sister, seeing what he's going through, but knowing that it was so hard for him to stop. We kept him at home. We never kicked him out on the streets. There were other kids that we know that died on the streets of Kensington. So we kept him in the house. And if he didn't live with my mom, he lived with me. And we would go back and forth. Who could handle it at the moment? I reached out to rehabs, state reps, doctors. We could not find treatment for him. We were turned away at almost every place that we looked. At one point, he was admitted to the hospital because he needed kidney dialysis. He developed something called rhabdodialysis, which is something that crushing victims can happen in accidents. It's like a breakdown of your muscles. So he would get himself in positions because he would hide in the bathroom. And that's what contributed to this, because he was always in hiding somewhere, whether it be at home or at a Dunkin' Donuts, different places, because of the shame and stigma. And in our area, there was nothing. We had no Narcan. We had no safe injection sites. There was nothing in 2010. I just think that so much of the system failed him. The only people that actually listened to me were my state reps back in, I think it was 2009. And I sent a heartfelt letter to Josh Shapiro, was our state rep, and his secretary at his office had so much compassion. And she said, I will get him into rehab. We're going to get him in tomorrow. And it was the first time that I had seen anyone show any kind of compassion towards him and our family. The treatment lasted a little while. It didn't last long enough, which it really never does. But that right there was, I will never forget that they looked at him as a human being. When I had been turned away so many times, when police officers would come to my house and he would overdose, and they would mock him lying on the floor and say, he's going to die, he's worthless. I would have nurses at the hospital say, we can't keep him. There's nothing we could do. 3 times in 1 week, I had one nurse say that to me. And he just kept coming back and coming back and coming back, and they did nothing for us. I just think that so many people, he wasn't given a chance, because the night before he died, he said to me, he seemed okay. And he says, I really want to get better. And the next morning he was gone. So I feel that there were the stigma, society, parents, that mother failed my brother by introducing him to these substances. The criminal justice system failed. We have had a generation of millennials, and their lives have been extinguished. And a lot of people don't want to talk about it. When this started happening, a lot of people I knew wouldn't want to talk about it. Parents didn't talk about it. They were ashamed of this is how their child died. Siblings would not talk about it. And I would talk about it because we're just perpetuating that stigma. We need to come out and show people it can be anyone's child, or your brother, or your sister, or your aunt, or your mom. It's touching everyone's lives. So I really believe in harm reduction. I think Narcan could have definitely saved his life. I think compassion is a huge thing. I think he was so ashamed of how he ended up, how he got there. And I knew that was not him. It's like the drugs took his soul, because that is not he was a beautiful person. So I don't want his death to be in vain. I continue to tell my story. People that have lost their loved ones along the way, they usually reach out to me because they thought maybe it couldn't have happened to them. I just feel like I want everyone to know his story. My boys know his story. We've made backpacks to give out to the homeless and people that are addicted to drugs with his name on them, so that he's not forgotten, and that they know that there's so much more to him. At this point, I'm very upset with how we're rolling back all the things that we've accomplished so far since 2010. Because I really think that, groups like GRASP, which I feel like it really saved our lives, my mom and I, when my brother passed, it was such an incredibly complicated loss and an isolating death that no other groups, we didn't fit in those other groups where they looked at us, oh, your son died of a drug overdose. That's different than the other kinds of losses. So I feel that, like I said, I'm happy that we've come this far. But we need to be more vocal at this point so that we don't roll back everything that we've accomplished. And I'm very happy that in my county, where we've had so many overdose deaths, for Overdose Awareness Month, like on Saturday, they're giving out Narcan kits and wound care with one of the groups that I'm involved in, testing strips, because they're trying to provide like no judgment and care over stigma. It's a group called Monco for All. And then our commissioners have set up something where they want the residents of our county to provide feedback for the next couple. They have like a whole week where we can provide feedback and tell them what we think should happen and how we can help with shape the substance use disorder services in Montgomery County. So that gives me hope that in my county that we're starting to, concentrate more on like what we need to do to help these people instead of criminalizing them. So, but thank you.
Thank you so much. Thank you, Kelly. Appreciate it. Thanks for telling your brother's story. It's important. And that's, the parents get a lot of attention. It seems like, especially mothers are quite a group that speaks out with all these issues. But, we have to remember there are sisters and brothers, there are children. That's one thing that we don't talk a lot about. Mm-hmm. There are children left behind. Some of them have lost both parents to overdose, and the grandparents left behind raising them. So this isn't just about mothers. It's whole extended families and all the relationships that exist. So thank you for the sisters sharing your life after losing your brothers. And our last speaker will be Aisha Betancourt Esquivel. She's founder of the Brianna Land Foundation, which consists of 4 moms who've lost children, 3 to substance loss and 1 to suicide. Aisha lost her daughter Brianna in May of 2019 as the result of substance use disorder. And Aisha is from Illinois, as am I. So we have met in the past and advocated together in different venues. So go ahead, Aisha.
Thank you. Thank you for having me. Again, my name is Aisha. I am the founder of the Brianna Land Foundation. Originally in 2019, it was the Brianna Land Project, but I met 3 other moms. All of our kids had gone to the same high school at different times. And then 1 additional mom just lost her son due to suicide recently. So we are now the foundation because we give back to communities in some way by raising awareness, hosting events that will gather people so we could tell them what we know about substance use disorder, and all the things that go along with it. We also are providing gifts to children that are impacted by substance use or substance-related deaths, and also contributing to funeral fees for the unexpected loss, because we were all shocked and didn't have life insurance because you don't think that your young person is going to pass before you. We also have a branch that is dedicated to finding EMTs help and also Spanish speaking. So we are represented in that way here, but my best role is being Brianna's mom. I'm the mom of 3 children. Brianna was my oldest. I was young when I had her, and so we kind of grew up together. When she was in high school, there were lots of other contributing factors that I looked back on and said, I missed that. But I thought my girl and I were so close. She was like my best friend. We had private jokes and we had certain songs that we'd sing together in the car, and we were just really close. And so, unfortunately, before she was 21, one doctor gave her Xanax for anxiety and sleeplessness. And within the same year, a different doctor at a hospital prescribed her painkillers for chronic pancreatitis. Ultimately, she would gradually go through what you see people go through addicts, right? Gradually she changed. My daughter was super strong, super beautiful, super smart. She spoke at senior class president, at her high school. She was tiny, but she was mighty. She was a good leader. So I dealt with what she was going through as a behavioral issue. Just like James mentioned that he had done something right in his experience with his son, looking back, there was a lot of time and regret because I got it wrong. I got it wrong on the most important issue of my daughter's life. And sadly, our kids are still on the other side of life. In May of 2019, my daughter she was house jumping, right? Because people who suffer from substance use disorder, I think Kelly may have said how they change. They're no longer those vibrant human beings. The shine kind of wears off, and all of our kids are super special. That's something that I've noticed. Like, all of our kids have this pizzazz about them, this captivating personality. But slowly they change, and not just change to be sad or down, but to be angry or to lash out, to become abusive. And my daughter went through all of that. And so the last time I saw her, she had pulled a knife out on me. Her sister was there, and her sister was her best friend too. Like, we were just a really close-knit family, but when the girls were together, they would joke about me because they were so close, and they were like night and day. And my younger daughter always looked up to her big sister. A lot of young people looked up to this girl because she was just so amazing. And on that day, that was the first time she stood up to her sister. She said, "Brianna, you need to get your life. You need to get it together. You're a grown woman now." And that was her parting words to her sister. Shortly after, her sister died as the result of combined drug toxicity. At some point, when she had no job, she had no money, she had no one to depend on anymore, she ended up somehow getting involved with heroin, and it was heroin and Xanax that ultimately took her from us. And immediately after I got the news and started punching everything around me and screaming out to God to say, "God, I prayed for her every day. This wasn't supposed to happen. You're supposed to love her even more than me. Why is she gone?" I went through all of that. And then within 30 minutes or so, I heard something tell me, "Aisha, what are you going to do with this pain?" And so I knew I had to do something. I had to learn everything that I messed up on so that I could share it with other people, because I didn't want families to know how horrible this felt. And although other family members wanted us to say it was a seizure, some type of medical issue, I knew my daughter, and I knew her as a leader, and she would not have wanted to die in vain. She would have wanted to help. There's no doubt about it. And since that time, there's the drug-induced homicide group, right? They know where to get you. They will find you, they will grab you, and they will hold on tight to you. And they're very strong in numbers. But one day, as I'm in a protest, I look around and I'm like, these moms don't look like me. Their things they were talking about was not quite like what I had gone through. We came from different physical environments, right? And our kids went through different things. And I said, let me get further into this. Let me see how this all happened. So I learned the history of drugs in our country. I learned the racism and the classism besides drugs, behind drugs in our country, and when they were made illegal and why they were made illegal and what they had been used for and what classes of people were not looked down upon with shame and stigma, but they were able to use drugs. The alcohol use in our country, that's legal, and who's benefiting from that? There's so many people that are dying of alcohol use, but we don't compare that the same as other substances. Our youth and energy drinks and vaping, there's so many opportunities for us to do better. With the drug-induced homicide group, one of their slogans is, locking up a drug dealer may not save my child, but it might save yours. But will it really? because statistically, the evidence, the facts say that is not the case. All that is doing is taking somebody, a low-level dealer, away from their families, as opposed to being assessed for their own illness. And as James said, somebody else will be right in there to take their spot. They're low-level dealers. What that drug induced homicide law is going to do is put more men and women who have mental health problems in prison. It is going to take more poor people, more people of color, and lock them up. People want to talk about the borders. Guess what? You know, people say putting them in jail, they will have access to drugs in there. They will not necessarily be rehabilitated. And access to care is so disproportionate in different communities. And again, more statistics and research shows that. So instead of me being stuck in my anger, I chose to go a different route with the new information that I knew. And it's not just for people of color, it's for everyone. But I don't want to put value on my child's life differently than on somebody else's child who thought they were smoking cannabis or thought they were just trying something for the first time, because it makes it seem like my daughter went through her illness as if she deserved to die because of her choices, when their children are more innocent. And if you look at the photo of certain things being written into law, and you look around at who's behind the person that's signing it, you see they don't look like me. You see they may not look like Kimberly. And it is an issue. It is a big, big issue. And cages are not going to work. Care and compassion are the only ways to get through this. That's
Thank you so much, Aisha. That's going to wrap up the speakers. So now we'll proceed with the Q&A. The first question I have is to James. I hear you have a bicycle program that you run. What is the goal of it, and what is it?
The goal is to create another tool in the toolbox of the person who is going through treatment, so that when they leave that facility, they wake up one day and things aren't going well. They reach a point of making a decision one way or the other. There'll be something there that they can simply walk out into their carport, get on and go for a ride, clear their head. We've done this taking clients in groups out for the last 7 years, twice a week from the local treatment centers. They bring them to us in a van. They trust them with us for the next 3 to 4 hours. And we simply ride out on the bike trail. We stop and have some trailside chats. I share with them the impact that addiction has on the family member, which some of them have not had that conversation. And at the end of the ride, for some now, I'm able to give a new bicycle thanks to money that's raised and relationships with vendors, so that they can take this with them when they leave. And the other thing that I like to do on the first ride that they attend, every person gets a shirt that has our name and logo on the back of it. And I literally want them to know that we've got their back. And it is so heartwarming to find out that someone says, I was at an AA meeting, an NA meeting last night. What's this with all the shirts that have your name on the back of them? It's just heartwarming to know that these folks know that we've got their back, and are proudly, and we're proud to be able to be a part of their recovery.
That's wonderful. What a great program. Our second question is, how do drug-induced homicide laws undercut the Good Samaritan laws that many of us have fought for and supported for years? Does anybody like to answer that?
I will. The drug-induced homicide laws will make people afraid to call for help. My daughter was down for 10 hours, between 8 and 10 hours. That person that was with her very well could have called. And that's something that many of our kids went through, many of our siblings went through. So not only are we providing a disservice by implementing that. But it's also just adding to the stigma, adding to the shame.
Agree. And for people who don't know what the Good Samaritan laws are, these are laws that protect people when they call 911 in the event of an overdose, from being prosecuted for possession, drug use. They're all different, but there's a lot of workarounds with this. Prosecutors know how to get around the Good Samaritan laws. Often, then these people are actually charged with Class X felony, contributing to the person's death. They're often, if they have warrants, they're brought in. So really, all the workarounds, and especially with the ramping up of the DIH laws, which give some really, really brutal sentences to people, just friends sharing drugs with each other. If one lives and one dies, the other one can be prosecuted for homicide. And we're not prosecuting the upper level, cartel members. That's not who's going down for these under these laws. It's friends, it's families, it's husband and wives using together, and it's just so wrong. And that's one thing we all of these panelists agree on, and we're all fighting back against. So the third question is for India. How are you getting younger people involved in the harm reduction overdose prevention movement?
So I found that social media is super useful and helpful right now. We have done a lot of like panel events similar to this one. We've also done like YouTube videos. I've also done a podcast called F the Stigma. That was really helpful because they have a really big young following as well. So really just social media. And then I went to college at the University of Maryland, and I also started at Virginia Tech. So having those conversations there about mental health and substance abuse was really helpful, especially because a place like Virginia Tech, you're lonely in the mountains and there isn't much to do. Sometimes kids are drawn towards things like that. So we definitely have those conversations. My professors, they were also super helpful when they knew that I was going through the things that I was with Bryce. They were super helpful in talking to like my classmates and even with me about what it looks like to navigate substance use and be that person for someone else. Social media has also been super helpful with just like I found like TikTok videos, like my mom and I have both shown up from both of our appearances on TikTok, and I find myself like almost like telling people what it looks like to have empathy for people in these situations, because a lot of them are like, why'd you let your kids do drugs? So I have to like kind of break it down and explain to them like that's not necessarily how that works. When you go through it with somebody in their family, that's how you get the chance to really like experience it firsthand. And we don't want anybody to go through those things again. So between that and just being involved on campuses and having campus events, most of the time when my mom and I go to my campus and have an event every few like quarters, they're super interested, and our health centers want to be involved. They're always giving out like naloxone and what to do, how to use it, things.
I was having a hard time hearing India. I hope everyone can hear me. To wrap this up, I'd like to ask all the panelists if there's a last minute or last thought that you would like to add. I know Kimberly, you wanted to say something for sure.
Yeah, thank you, Tammy. I wanted to add just that, as India mentioned, we live in Maryland, and we're in Prince George's County, Maryland, which is the largest African American affluent county in the state of Maryland. And every county around us has naloxone accessibility, has programs around International Overdose Awareness Month and Day. And our county is not doing anything. And it feels like it's by design. And it also feels like it is, we are perpetuating, it's like the stigma, right? We're not talking about how our young people and actually how our older African American, like in Prince George's County, it's 55 and older African American males who are now the highest rate in our county of dying from overdose. And so we're just not addressing it in our county. And so Bryce's Treehouse has actually been working with our health department and our substance use prevention team here to try and get people talking about it more. We have a few universities here in Prince George's County, including University of Maryland and Bowie State University, which is an HBCU, and trying to get the administrative offices talking about it on those campuses has been horrible. We've had to start grassroots and start with the students, as India has mentioned. And so, I just want to invite folks out who are in the Maryland, DC, Virginia area to Bryce's Treehouse event that is happening on Sunday, August 30th, from 2 to 5 p.m. We will have a special remarks by the Maryland Special Secretary of Overdose Response, Secretary Emily Keller. We'll have a couple of panels talking about loss and grief, as well as hope and recovery. And so, we are really trying to make big headways here in Prince George's County, Maryland, to make sure that, that we are addressing not only the stigma, but, making sure that our young people and our older adults are really aware of how to save a life. I know India and I, back in March, we did a couple of talks at University of Maryland, and we had the hardest time just trying to find access to naloxone here in our county. So I feel like it's by design. We have the highest number of affluent African Americans almost in the country. If you do that research and look at those numbers, but it's been hard. It's like every other county around us recognizes the stigma and recognizes the overdose deaths except for us. And so I'd really, would appreciate if folks would spread the word, and just so grateful for the opportunity to talk about it.
Thank you. Does anybody else have any quick last minute? Okay.
Yes.
Go ahead, James.
I sit on the state's Opioid Settlement Council Fund, where we review hundreds of millions of dollars of requests for the opioid settlement money to be used for grants. Every city, every county now is receiving opioid settlement money. And some states like Mississippi, they don't even require the city or the county to spend that on addiction-related causes. They can spend it on anything. Go to your city council meetings, go to your boards of supervisors, ask what they're doing with the opioid settlement fund, and hold them accountable for using it in a way that makes a difference.
Yeah, all of our voices matter, sort of. Sometimes they listen, sometimes they don't, but we sure can try. Anyone else?
I just want to say a couple things, and I'll speak really fast because it didn't come up in our conversation previously. I want to mention that reclassifying the drugs with different levels, all that is going to do is make the drugs more dangerous. They're going to change the chemistry behind the drugs. And if you've noticed, fentanyl is not the worst thing that's out there now. There are other substances connected to the fentanyl that do not respond to naloxone. So that's one thing. Another thing is people have to learn who they're voting for. There's a lot of trust in certain politicians, and they don't realize that these politicians may not know the truth about things. They're just going based on popular opinion. And I think sometimes when it comes to substances, we're seeing that a lot. So it's really important to know who you're voting for. There is a break within the medical system. Okay. Our kids, if they overdose, they're out of there within 24 hours, even if they have to go back again. And did you know some hospitals don't even test for fentanyl? And so there's certain things that we ourselves have to educate ourselves a little bit more, and then connect with those people to make it a positive change. Some case managers at hospitals don't know what to do, where to go. They say, follow up with your PCP. But if you know somebody who's struggling with substances, they probably don't have a PCP. So let's really think logically about certain things. And for Cook County, again, I'm in the Chicagoland area. Because of the tornadoes and storms, we had to reschedule our Overdose Awareness Day event. We now added Save a Life Day to that because it seems more friendlier to people who don't want to go to an event that's just for overdose. Right. Yeah. So we use Save a Life Day. We add resources beyond just substances. We have mental health, gun violence, things like that. And That is going to be occurring now. The rescheduled date is September 20th. It's a Sunday, I believe from 11 a.m. to 4 p.m. And yep, September is National Recovery Month. So if there's any other time we could do it, it's going to be in September. So anybody in the Chicagoland area is welcome to come join us. It is at Commissioners Park, 311 Chicago Road in Chicago Heights. Thank you.
Thank you. We had a couple questions I don't think we're going to get to because they're quite in depth, and we could spend the next 3 hours possibly discussing about how we get at the demand side of our drug problems here and throughout the world. And because that's really where we need to look, is the demand side, not the supply side. And that's tough. Why? Why are we using? Why? How do we stop? It's so complicated, and there are so many factors to play into why people use drugs, and it's really part of the human condition, right? So I don't think we can totally get into that, but I wanted to acknowledge that one of our attendees had asked, and it's a big deal. But I think we're getting. Sure, go ahead, Kelly.
Oh, I just wanted to say real quick, I think that that's the other component that sometimes, like, when I worked in like co-occurring disorders. So I think that that's such an important factor, because I know so many of our loved ones had not just substance, but an underlying mental illness, or whether it be ADHD, which is what my brother was diagnosed with. The drugs calmed him down. So I think we need to, instead of like, I feel like a lot of times they're still treating all of this as a parallel thing and not together. And I think that really needs to change. And we need to start the kids so much younger with, developing their emotional and social skills and centering on their strengths and not their weaknesses in that disease model, which I think we're trying to get out of, but it's still there. Just, more of a person-centered approach, and just to, focus on what is good about them instead of just what's wrong about them and weaknesses. I think it's just really important.
And the other part of the problem with treating co-occurring mental health disorders is our medical system. As a physician, I can say our system is broken. And especially as it comes to mental health, we do not have enough providers. I've had people suicidal that wouldn't go to the ER, where it's a 2-month wait to be seen. I'm like, okay. So anyway, that's why this is a huge topic that we spend a lot of time on. But we are at time. I just want to remind everyone that International Overdose Awareness Day is August 31st. And I hope everyone will take a minute on that day to remember all of the people that have died from overdose, and to have us, the family members, left behind in your thoughts, prayers, whatever it is, because we're all still suffering and will suffer with this loss for the rest of our lives. So let's light a candle, remember, but then get back up and fight. So thank you all so much for attending today. And this will conclude our webinar today.
Thank you.